Alright, in the previous lecture I talked about a cell and how cell will adapt to situation based on the level of stress, and I told you hypertrophy, hyperplasia, atrophy and metaplasia, and also I mentioned sometimes the cell cannot tolerate that stress and cell will be injured. One of the outcome of this type of injury actually is necrosis. That means cell will be dead. And necrosis is death of groups of cells. Because when we talk about the cell death, okay, we say cell is dead. But necrosis is, we do not use to describe one cell death. Groups of cells and the other part of a tissue or organ, when it's dead, we call it necrosis. What is happening in this type of course, cell damage? I can discuss with the detail, but the most important part is nuclear changes. Here I draw this diagram to show you, okay, how the nucleus of a cell looks like. And here I mentioned three different terms which describe nuclear changes during necrosis. One of them is pycnosis. As you can see, this nucleus is shrink. Another one is karyolysis. The nucleus, the basophilia of nucleus will be pale. That means the density somehow, when you do hematoxylin and eosin staining, the nucleus will be pale compared to the normal cell. And lastly is karyorexis. As you can see, the nucleus will be fragmented. These are the three different changes during necrosis will happen to the cell nucleus. However, the most important part of necrosis is different type of necrosis. I wrote for you coagulative is a term to describe. All of them are necrosis. That means what is happening to the cell. It doesn't matter. Coagulative, liquefactive, caseospect, and fibrinolytic. All of them, they have the same mechanism for cell process. Of course, what is the stressor? Chemical, electrical, physical, whatever causes cell injury, doesn't matter. What will happen to cell will be dead. But what we will see a bit different, depends on which organ is that. Coagulative. We use this term to describe that type of necrosis, which tissue is dead, however, the structure still is dead. The outline of the structure doesn't change. Imagine kidney. When portion of kidney is dead, you don't see a gap or cavity over there. You will see a structure of the kidney still is done, and that portion, like pyramid shape, whatever it is the tissue is different. It's not vital tissue, and you will see after a while, of course, of those fibrotic part in the, and of course non-functional. Same thing for many other, like a spleen, like a liver, heart. You think after myocardial infarction, what will happen to myocardium? Is that area is going to be empty? Of course not. It cannot be a whole, because the structure is there, but it's dead tissue, non-functional dead tissue, which will change to fibrosis actually. Liquefactive. Oh, by the way, before I continue with second type of necrosis, I mentioned myocardial infarction. Let's define infarction. Actually, infarction is gross manifestation of coagulative necrosis, what we will see grossly. And we have two different types, pale necrosis and red, or pale infarction and red infarction. What does it mean? When we said red in tissue, that means we have a lot of red blood cell over there. This type, we call it hemorrhagic as well. The reason is the red blood cell goes out of the capillaries and it will be between the dead tissue. That's why we will see red. And it must have a space to do that. Like lung. In function of lung, normally we will see red because there are a lot of RBC. But for some other organ, it will be pale, like kidney. When it will happen, it will be pale because there's not red blood cell between those two. Just actually describing what we will see grossly and also microscopically. The second type of necrosis, we call it liquefactive. The term is defining itself. That means the outcome of that necrosis will be like a liquid. The tissue will be soft. We will see the softness of tissue, and the tissue will be like a fluid and liquefied. And even after a while, those things by macrophage, they will be removed, and you will see a gap. The most common example for this type of necrosis is CNS, brain. When we have brain necrosis, you will see this. By the way, in general, we are going to define many types of necrosis, but for nearly almost all of our organ in body, we will see mostly coagulative type of necrosis. Except for CNS, brain, we will see liquefactive. What is caseous necrosis? Still, the term is describing, because caseous meaning something like a cheese. And what is this necrosis? Actually, is one variant of coagulative necrosis. That means the structure still is there. However, what we will see some cheesy-like material. That's why we use the term of caseous. There are many diseases, some diseases they can cause caseous necrosis, but the most common example of caseous necrosis is Mycobacterium tuberculosis, which attacked the lung and it caused caseous necrosis. Mycobacterium tuberculosis can attack every single part from head to toe. But here we are talking about the lung, and it causes cheese-like material. We call it caseous necrosis. Next type of necrosis, we call it fat necrosis. What is fat necrosis actually? Still is telling you, only fat tissue. We describe this. How is happening actually? For instance, how we digest fat. We have enzyme to digest fat, and those enzymes comes from pancreas. Imagine something happened to pancreas, and those enzymes are released. When they're released, they don't care whatever is they are exposing, they damage them. And we have a lot of fat around those areas which in our abdominal cavity. If something happened to pancreas, like pancreatitis, and this enzyme, which is lipase, is released, then it damaged the fat and it caused necrosis because it digests the fat. And as a result, when the fat is broken by lipase, we will have fatty acids. Those fatty acids, over there we have calcium as well. Fatty acid plus calcium is a simple chemistry. Everybody knows fatty acid plus salt, which in this case is calcium, it gives you soap. And with this process, we call it saponification, exactly like a sapon, which we use to wash our hand. It's the same mechanism, but it's happening in our body. Of course, it's not good, and it's damaging everything. And it's one of the ugly things when you open the abdomen, you will see. But fat necrosis not always is like that, which needs enzyme to break fat. Sometimes we have fat necrosis because of trauma. That means fatty tissue is traumatized by something, like any mechanical things, like a car accident and many other things, and the tissue will be dead. The good example of fat necrosis always is breast trauma can cause fat necrosis of breast. And remember, in this case, there is no enzyme. In only trauma causes that, not enzyme mediated. There is no enzyme. But for pancreas, yes, of course, enzyme. And last type of necrosis is fibrinoid necrosis. In this case, it's what is happening is some type of immunological reaction. You know antigen, you know antibody. The complex of antigen and antibody will be deposited where, mostly we are talking about blood vessels, will be deposited in the blood vessel and it causes damage and necrosis. Example of this we have plenty, but one of the most common organ can be affected with fibrinoid type of necrosis with immune complex is kidney, arterioles of kidney, glomerule of kidney can be damaged simply by deposition of that complex, which is antigen-antibody complex. This is very brief thing about necrosis. In the next step of this lecture, I will compare apoptosis and define apoptosis and compare apoptosis and necrosis. All right. After learning about adaptation, necrosis, the last part is apoptosis. Apoptosis is we categorize, and I'm explaining after necrosis because it's a pathway of cell death. How the cell regulates to kill itself. We call it regulated suicide program. What does it mean? Is bad or good? Is it physiologic or pathologic? Actually, we have physiologic and we have pathologic apoptosis. Physiologic apoptosis is actually helpful. Why? Because sometimes we have type of cell. We do not want that cell will be, do mitosis and will be duplicated and go growing like a type of immune cell. They did something and they have no function for us anymore or maybe harmful. It needs to be removed, but in the silent phase, not like necrosis, which causes necrosis always is pathology. Or very simple, let me tell you this example. During development, during embryonic life, the fetus will develop, and it starts from one cell, and 2, 4, then blastocyte, and eventually after 9 months will be a baby. But when you study embryology during different phases, you will see they are gradually getting the shape of the humankind. And eventually they are in one ball of cell. What is happening? For instance, why our fingers, look at here, we have 5 fingers here, and there is a gap between them. Why we don't have web? Because when you study the embryo, you will see at the beginning there is like a ball of cells, but gradually you will see the fingers are growing. But why this area between the fingers are not growing? Because the cell at that part is programmed to stop and to do not grow. And that's why we have 5 fingers like that without any weight. Just for imagination, look at very simple example like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just for imagination. Imagine this cell, they want to make fingers, just as an example. This one will grow, this one goes to apoptosis. This one will grow, this one goes to apoptosis, and same thing will happen. At the end, we have 5 fingers. That's why, just for understanding, is more complicated than this, but in simple way we can describe it this way, which those cells will stop to shape us the way we are. This is type of physiologic changes. And many other cells after embryonic life or our normal life, our immune system responds to many things, and some of our cells need to be, removed from the function, not in the necrotic phase. That is apoptosis. That means cell will be programmed to be dead. But this type of death is not like a necrosis. How do we know there is a difference between these two? The only way, the best way, is to compare what we will see in necrosis, what we see in apoptosis. For instance, cell size. In the necrosis, as I told you, the cell size will increase and eventually cell will be dead. But in apoptosis, cell will be shrinked. This is one thing. But still maybe it doesn't help you that much, but it helps. The second part is plasma membrane. When cell is going to be dead, and it is a necrotic cell, a necrotic tissue, and dead cell, the cell membrane will be disrupted. And you know, cell membrane is like a wall. When there is no wall, there is no house. And cell membrane is one of the functional important part of cell, which cover the cell, organelles, nucleus, and it define the cell. This is the cell, and this is my boundaries. This is my surrounding area. But when this does not exist, of course, the cell is not exist. Very simple. But for apoptosis, not at all. The cell membrane is there, is intact. Cell is shrink, but the membrane is there. That's why this is different. Very important and major difference. Content. When cell is dead, when I said the cell membrane is gone, all membrane, including lysosomes. Do you know lysosome is an organelle inside the cell and it's carrying enzyme? When there is no membrane, what will happen to those enzymes? It will be released well, wherever it is. And do they are smart to understand, okay, this is my body, I'm not going to hurt my body? No. They're going to damage the cell. That's why the enzymatic digestion will happen in necrosis. You will see enzymatic digestion. Exactly, that's why in leukoaffective necrosis, the difference between leukoaffective and coagulative was in leukoaffective, those enzymes will be released. In coagulative, they will be released, but they will be neutralized by some other substance. That means there is no function for those enzymes. Anyway, in necrosis, we have enzymatic digestion. But in apoptosis, no. Maybe something will change, will be apoptotic body, but never will be digested in that way, like in necrosis. Do we have adjacent inflammation? For sure. For necrosis, always, wherever we have dead tissue necrosis, inflammatory process will start there. We will see a lot of function over there, like coming macrophages, bacteria, polymorphonuclear first, macrophages, monocytes, all of those cytokines interleukin, they interact, which in general we call it inflammation. But in apoptosis, the cell is programmed to be dead. It's type of suicide, and there is no such things like adjacent inflammation. Here, yes, we have so many things is happening after necrosis, which is good in one term because it's type of immune defense mechanism. However, if it's too much, it's going to be harmful as well. I will talk about that in inflammation, with eye tissue inflammation. Physiologic or pathologic role. As I mentioned, apoptosis has both physiologic and could be pathologic, which I'm going to talk about pathologic right now. But for necrosis always is going to be pathologic because the tissue we need is dead. Yeah? Unless when we have some normal destruction of the tissue after the tissue done their, or cell done their job, like a red blood cell, after 120 days, they will be replaced with a new one. But it's not like necrosis, it's replacing that. Then, and the last part is pathology apoptosis. Let me talk about pathologic apoptosis and give you one example, and tell you it's good or bad. It's not always bad. Our cell has potential to repair their DNA. If something happened to DNA, like a damage because of exposure to anything, cell has potential to repair that DNA, but not all the time, not always. If cell cannot repair that DNA, what is the outcome of that cell? What is going to happen to that cell? Here, we need apoptosis. Apoptosis, if the cell cannot repair itself, then the body cell, okay, I give up. I cannot repair. But you go in the dead phase. They program it and they put the cell in this condition. Do you think this is bad or good? Actually, it's good in one way. Why? Who likes to have a DNA which is damaged? That means damaged or mutated DNA, always there is a chance for developing cancer. And as a result, apoptosis here is very helpful. If the cell cannot be repaired after damaging DNA, the best thing is to put the cell in the dead phase, which is apoptosis, instead of leaving cell the way it is and increase the chance of getting cancer because DNA is mutated. That's the good things about apoptosis which help us beside all of those physiologic function which apoptosis actually does for us. And in general, what we'll learn how to compare apoptosis and necrosis and what is the difference between these two. Hopefully it helps you. Then in the next phase, I will talk about inflammation, acute and chronic inflammation, and wound healing. See you soon. Bye.